Copyright, University of South Australia. This recording may contain third-party copyright material. Apart from any use permitted under the Copyright Act 1968, no part of this recording may be reproduced or rebroadcast by any means or process without the prior written permission of the University of South Australia and the copyright owners.
Welcome to a short video on the leg. So the leg, if we describe it, is more than just your whole lower limb. The leg is a segment of your lower limb which goes from your knee to your ankle. So the two bones that would be inside there are the tibia, which is flattened on top. Right, it has its two condyles coming, and then its shaft coming down like this. With its distal end, you have some large hammer-like projections, which are called malleoli. And then you would have the fibula, which articulates both proximally and distally with the tibia, making two different joints. So here we have the tibia, the larger bone to the medial aspect, and the fibula, the smaller bone to the lateral aspect. So some features that we have on the tibia, you have a large prominence here in the anterior aspect, which is your tibial tuberosity, and a smaller one on the lateral aspect here, which you can call your Gerdy's tubercle or the lateral tibial tubercle. So tibial tuberosity and your lateral tibial tubercle. Now what goes to these two structures are your quadriceps tendon and your iliotibial band as an example. Here, this is the head of the fibula. Its neck lies just below, alright, and then the proximal tibiofibular joint here. Alright, so this joint is a small synovial joint which only has a small amount of glide. Alright, whereas down here we've got our distal tibiofibular joint. And this one is a fibrous joint, so should not move under any circumstances. Now what lies between these two bones is a really dense membrane, alright, and this is called the interosseous membrane. Now it's there to try and stop the two bones from pulling apart, but it's also a really large origin for muscles. The inter for between, osseous for bone, membrane. Now you can see there's an opening at the top and an opening at the bottom, and these are so arteries can pass from the front to the back. So if we talk about the popliteal artery coming down behind the knee, when it divides into anterior and posterior tibial, the anterior tibial artery would come through here and lie in front of the membrane to go with the group of muscles which lie in front of the leg. Now, if we talk about the muscles in the leg, all right, and we were to look at this in a cross section, so let's imagine that we're going to cut the leg across here like this, and then we're going to view it from below. So what that's going to look like is you would have then your tibia, which is triangular shaped like this, and then the fibula out here, all right, and then you're going to have that dense interosseous membrane lying in between. Now our compartments of muscles, we have three. We have the anterior, we have the lateral, and we have the posterior. Now these groups of muscles are pretty big, they're quite strong, and they act on your foot. Alright, so if we call these muscles, we can call them extrinsic, being outside, extrinsic foot muscles. So here you would find your lateral group of muscles, here you would find your anterior group of muscles, and then you would find a deep set of posterior muscles and a superficial set of posterior muscles here too. Alright, then on the outside of that you would have a thick layer of investing fascia. Alright, and then out of that you would then have the skin, alright, with some fatty tissue in between that, alright, around your calves as an example. So the anterior muscle group, it's going to have a specified set of actions. It's going to create dorsiflexion, which is to lift the top of your foot up. It's going to do toe extension, so lift your toes up inside your shoes, so lift them up so they hit the top. and it's going to do inversion. So what you would do there is you would turn your foot like this so that you can see the sole on the medial aspect. Your posterior group then has to do some opposites. All right, it's going to do plantar flexion, which is to point your toes. It's going to do inversion as well, but then it will do toe flexion. Whereas now here we've got two groups doing inversion, so that must mean that our lateral group is going to have to do eversion, which is the opposite. That's to lift the lateral aspect of the foot up off the ground. Okay, now the muscles that are going to lie inside here, all right, if we use red, put them into their place, is we're going to have a very large one here. Then there's going to be one tucked away in here, and then another one in this space. So three muscles in the anterior compartment of the leg are going to be tibialis anterior. Then they're going to be extensor digitorum longus and extensor hallucis longus. So what is hallucis? Well, the hallux is the big toe. So it makes a bit of sense that you're going to need to have a muscle which extends the big toe. Digitorum means digits, so expanding all the toes, and this one here is going to be the one primary for dorsiflexion and inversion because it has nothing to do with the toes. Alright, so if we write those ones down, tibialis anterior, extensor digitorum longus, so that just means that it's a long one, and extensor hallucis longus. Now if you were not going to have a longus, you would need to then have a brevis. So brevis meaning brief or short. Alright, so they're the muscles in that anterior group there. And these are going to be innervated by a branch of the common fibular nerve, alright, which is called your deep fibular nerve. Alright, so that's our anterior group of muscles. Now what's good about having anterior and posterior groups of muscles is we don't need to have some sort of opposite, right? So if you've got a muscle which extends the toes, extends the big toe, and dorsiflexes, then you must need to have a muscle which plantarflexes, flexes the big toe, and flexes the toes, right? So it means that here we'll have a muscle lying directly behind the tibia, tibialis posterior. Then another muscle here, flexor digitorum longus, and then the muscle here, flexor hallucis longus. Alright, so that makes a bit of sense, doesn't it? Because you have to extend the big toe, you have to flex the big toe. If you extend the toes, you have to flex the toes. If you do some dorsiflexion, you have to do some plantarflexion. Alright, so they're the muscles which are in the deep group. Alright, so you can see a superficial area here, and these ones are in the deeper one. So they're the antagonistic pair for that group. Alright, so we've got tibialis posterior, which will do plantarflexion and inversion. Really also supports your arch of your foot. Then you've got flexor digitorum longus and flexor hallucis longus. Now in the superficial, alright, we're going to have two more muscles. They're going to be gastrocnemius, which is your calf muscles, the one that you see on people, and then the soleus, alright, which is a slightly deeper, broader, kind of all-day type muscle which works a bit more in the slow twitch type. Alright, so your soleus muscle is big and broad and occupies the whole posterior aspect of this area. And then what you would have is you would have the two bellies of gastrocnemius, alright? So the medial belly over here and the lateral belly here of the gastrocnemius, okay, the larger, more calf muscle. Now, these ones are innervated by another branch of the sciatic nerve, which comes from the popliteal fossa region, and this is the tibial nerve. Now, from there, our lateral group, we have two muscles here in this space. We have one which is slightly deeper and shorter, and one which is longer and more superficial. So these nerves here, alright, they're called fibularis longus and fibularis brevis. Alright, so one being long, one being short. So I'm just going to put an arrow down here, a bit more space. So we have fibularis longus and fibularis brevis. Now these ones, if you evert your foot, so lift the side of your foot off the ground, you can actually feel their tendons passing around the lateral aspect of your ankle, or the lateral malleolus. So these malleoli are the large ankle bumps that you can feel. Now malleolus means hammer or mallet in a way. Alright, so you can feel these two tendons. Now, when do we use those? If you go up onto your tippy toes and you pretend that you're rolling your ankle, what you can actually feel is that there's quite a bit of instability around the lateral aspect. Now these ones there, your fibularis longus and brevis, they're actually there to help resist this. So when you roll your ankle to the outside, that's actually inversion. So you can see here that these muscles create eversion, so they're there to help try and pull the foot back into a neutral position. So maybe even try standing up on one foot and onto your tippy toes and see whether your fibularis longus and brevis muscles are working. Alright, let's just have a quick look at those muscles on the model. So here, if we start with the posterior, this is the medial head of gastrocs and the lateral head of gastrocs, okay? And they come down and they attach to one really big thick tendon, which is your Achilles tendon. Now to lift off one of the heads of the gastrocnemius, what we can see is that there's a muscle which is deeper, all right? And this is the soleus, the broader, larger muscle occupying all of that space there. And this one here is called plantaris. Now not all of us have this, all right? So it's more of a tendinous structure inside of our legs, all right? But some of us do, about 20% of us would have this muscle plantaris. Now if I take that whole gastrocnemius and soleus complex off, then we can see those deeper muscles that we were talking about, you know, flexor hallucis longus, tib post, and flexor digitorum longus. So here on the medial side, flexor digitorum, here in the center. All right, you then have tibialis posterior, and here on the lateral side, flexor hallucis longus. All right, so these all pass down into the foot on the medial aspect and through a region called the tarsal tunnel, and we'll talk about that in another video. On the anterior aspect, we can see three muscles again, and you can see them all crossing the ankle going down into the foot. So this most medial one here is our tibialis anterior, coming down to the medial side of the foot. So you can see we lift the foot up and turn the inside in, so dorsiflex and invert. Then here, what you can do is you can actually identify the muscles just by looking at their tendons. So these four, you can see go towards the toes. Right, they're on top of the foot, so they're going to extend the toes. So what are we going to call that one? Extensor digitorum longus. Whereas if we have a look at this one here, coming all the way to the big toe, it's on top of the foot, so it'll extend the big toe. We know the big toe is called the hallux, so that's going to be extensor hallucis longus. All right. Now, if we remove this layer, all right, what it actually will show us is these are the two branches of the common fibular nerve. This one, you can see here lying deep, which is going to be innervating our anterior compartment of our leg. And this one here is the superficial fibular nerve, which actually comes and innervates your fibularis longus and brevis on the lateral aspect. So let's just add that in. Nerve supply to the lateral compartment is the superficial fibular nerve. All right, looking forward to the next video.